Good afternoon, and welcome to the afternoon or the evening session for the Boost conference. I come to you live from downtown Pikeville, inside the Kentucky College of Osteopathic Medicine. Sorry about that. And I am here today to introduce one of my good friends and colleagues that I have worked hand in hand with for over the past 25 years, Dr. Rakesh Sachdeva. Dr. Sachdeva is the founding partner of Physicians for Children and Adolescents in Pikeville, which is one of the largest pediatric practices in Eastern Kentucky. Dr. Sachdeva and his wife, Dr. Seema Sachdeva, have served the healthcare needs of the children in Pikeville and adjacent communities since 1995. He currently serves as the director of Physicians for Children Home Place Clinic in Pikeville. Dr. Sachdeva is also the founding chair and professor of pediatrics at the Kentucky College of Osteopathic Medicine, where I'm at now, at the University of Pikeville since 1997. He has mentored and precepted more than 140 graduates of the school who are currently practicing pediatricians or serving their pediatric residencies. Dr. Sachdeva is a passionate member of the Pikeville Rotary Club and has served as its past president. He has served as the district governor for Rotary International, District D6740, which encompasses the eastern half of Kentucky. Dr. Sachdeva and his wife, Dr. Seema Sachdeva, have facilitated a multitude of clean water, sanitation, and global healthcare projects. They are ardent supporters of the Global Polio Eradication Initiative. Dr. Sachdeva also serves on the advisory board for the Pikeville Medical Center Foundation for Quality Healthcare, State Advisory Board for Truist Corporation, Board of Directors of WellCare Corporation of Kentucky, and Board of Trustees at the University of Pikeville. Dr. Sachdeva was a personal invitee of mine into this conference today because he's a man that I know that has dealt with directly the need and importance of preventative health along with vaccinations. It is a pleasure that I get to introduce my colleague and friend, Dr. Rakesh Sachdeva. There you are, Doctor.
Thank you so much, Joel, for your kind introduction. I am very honored and privileged to be talking to all of you from the Kentucky College of Osteopathic Medicine, and a shout out to my medical students, about 125 of them, who have been tuning in this conference. So I'm going to talk today about polio, time to write the final chapter, and what I'm also going to do is I'm going to talk about the lessons that we can learn from the polio campaign and how we can apply it to the current COVID crisis that we are facing right now. So we'll be talking about the triumph of vaccines. And there have been only 2 diseases that we can say that pretty much are on the verge of global eradication. There is one disease that all of you know, that is smallpox, that had ravaged humanity for more than 6,000 years. But it has been globally eradicated because of a successful, effective, safe vaccine, and also because there was the vaccination campaign was executed globally very, very effectively. So when I was a child, I got the smallpox vaccine. Probably my medical students did not get the smallpox vaccine, and I'm sure there's lots of folks in the audience who did get the smallpox vaccine. Now, today we are kind of on the verge of eradicating another disease that has ravaged humankind for more than 4,000 years, and that is polio. When I started my medical school, there were hundreds of thousands of cases of polio. When I started my residency in 1985, globally there were more than 500,000 cases of polio. And in 1988, there were 350,000 cases of polio. And this year, we've had only 2 cases of polio, and that too in just 2 countries, and we'll be talking about that in detail. So what I'm going to do is I'm going to go over a brief history of polio and how the vaccine developed, and then how we've been able to pretty much globally eradicate polio from the face of the earth. So as you all know, polio, it's a Greek word, and it is derived from polio is gray and myelin is marrow in the spinal cord. And we know that there has been proof of polio since 1400 BC, because some of the Egyptian excavations depict a young priest with a shortened and a deformed foot. In 1789, a British surgeon, Michael Underwood, made the first clinical description in a book that he wrote about how there is a child who has lost his ability to walk. And then there have been documented outbreaks in England, in the United States, in St. Helena between 1831 to 1835 that were caused by polio. In 1840, Jacob von Hein first described infantile paralysis. And since then, we've known that in 1890 through 1900, there were epidemics of polio in Scandinavia, well documented in New England. And in 1908, it was Karl Landsteiner who described the contagious nature of polio. When infected monkey tissue was injected in another monkey, the other monkeys came down with polio. So that's how we established that this was a contagious disease. And in 1916, the Rockefeller Institute described the polio germs as microscopic, bright, dancing voids without a definite form, which we know as the poliovirus now. In 1916, we had the most serious case of polio in the United States. 27,000 people lost their lives, about 6,000 people died. And in 1921, President Franklin Roosevelt contracted polio. And he has contributed so much. You know, when we talk about global eradication of polio, we'll be talking about the contributions of President Roosevelt. And from the 1920s to 1950s, we would have major epidemics that would occur on a regular basis in the United States and Europe and in Australia. In 1938, Elizabeth Kenny in Australia figured out that physical therapy helps recovery or rehabilitation of polio. And then again, in 1938, President Roosevelt established what is called the National Foundation for Infantile Paralysis, which is also called the March of Dimes. Now remember, polio, it is an enterovirus. It is an RNA virus, and there are 3 serotypes. So there's a type 1, type 2, and type 3. So when we talk about global eradication of polio, we talk about the eradication of 3 diseases. And there is a minimal amount of immunity between the 3 serotypes. So if you get type 1, that doesn't mean that you're protected against type 2 or type 3. And this is a picture from 1916, and it's taken in New York. And you know, when folks started to live in close quarters, they figured out that, you know, there would be polio in areas where people were living in close quarters, and they linked dirt and houseflies with the disease. And then later on, we understood that they were important vectors in transmission of the disease. So the polio myelitis or polio, the entry of the virus is into the mouth. And the virus replicates in the pharynx, in the GI tract, in the gut-associated lymphoid tissue, and then it spreads through the blood or through lymphatics into the central nervous system, and eventually causes destruction of motor neurons. Or it is a lower motor neuron paralysis, so that's why you have flaccid paralysis, and it is asymmetric. Now, when somebody contracts this enterovirus or the poliovirus, about 95% of the people would be asymptomatic. And so this again was a huge problem, and it is still a problem because when we talk about global polio eradication, 95% of the people who contract polio are asymptomatic. They will show no signs or symptoms that they have the poliovirus, yet they would shed the virus in the stool for about 6 weeks. About 3 to 4% would have a non-specific illness, and about 1% would have aseptic meningitis, and less than 1% would have the disease, which could be spinal, where you have paralysis of the lower extremities or the upper extremity, or it could be bulbospinal. That means, you could have involvement of the diaphragm as well. I want you to ponder on this picture, so this is a young girl from the early 1950s, and what you see is that she's contracted polio. She's been removed from her family. She's in a hospital, and she is in this huge machine that we used to call iron lungs, and it was a negative pressure ventilator. And there is an eerie similarity that we have right now with the COVID pandemic. And what we are seeing right now, and if I were to quote the statistics from Friday, September the 17th, in Kentucky, we had 5,100 cases of polio and of COVID-19. And so we had 5,100 cases of COVID-19. Of those, 463 people were on a ventilator. And the difference between those folks who are on the ventilator, the 463 on September 17th in Kentucky, and this young girl, is that this young girl did not have the option of an effective and safe vaccine. Whereas the majority of the people who are on ventilators in Kentucky right now have not been immunized. There is a safe and an effective vaccine that's available, but they have not been immunized. And then again, talking about how there are certain factors that are so important in the control or the eradication of polio. The virus starts to, before you catch or before you start exhibiting the symptoms of polio, you start shedding the virus 7 to 10 days prior to the symptoms. And you kind of shed the virus for about 3 to 6 weeks. So there's a long period that you would be asymptomatic and shed the virus, and then post-contractual of the poliovirus, you would still be shedding it for 3 to 6 weeks. And this slide shows you the difference that the vaccines have made. So if you can see here, we used to have about 25,000 cases of polio through the 50s. And then once the vaccines were introduced, we've pretty much eradicated polio. So there are two types of vaccines that we are using in the United States and globally. The inactivated polio vaccine, which is used in the US right now. So this vaccine has 3 serotypes. It's grown on monkey kidney cells. It's inactivated with formaldehyde. And it was developed by Dr. Jonas Salk. And so here you're seeing Dr. Salk administering this vaccine. It's very highly effective. And after about 2 doses, about 90% of the people are immune. And then after 3 doses, about 99% of the people are immune. And the duration of immunity is not certain, but it is protracted. The oral polio vaccine, on the other hand, there are 3 serotypes. And again, this is grown on monkey kidney and the Vero cells. So this is the Sabine vaccine. And then, these are given as drops. And so many of you would remember that these were given as sugar cubes. So again, the oral polio vaccine it's very highly effective, but see that 50% of the people who would be immune after one dose, about 95% after three doses, and the immunity is probably lifelong. Now, the oral polio vaccine is a live attenuated vaccine, and so that's the reason it is still being used in countries where we have fear that polio might come back because the gut associated lymphoid tissue and the immunity that is produced is an IgA mediated immunity in the GI tract. In the United States, we use the inactivated polio vaccine, and it's given at 2 months, 4 months, 6 to 18 months, and then it's given at 4 to 6 years. Now, 4 to 6 years, and then we also use the IPV can be given by itself, or it could be a part of the combination vaccines. Reactions to the IPV are very, very rare, and they're mostly local vaccine. I want you to look at this map in 1988 when we had 350,000 cases of polio. Pretty much, we had polio in pretty much Africa, all of Asia, some parts of Western Europe and the Americas were polio free. And this is the map in 2002. You still have India, Pakistan, Afghanistan, parts of Africa. And this is the map in 2018, where you just have polio in pockets of Pakistan and Afghanistan. And this is where we stand today. Less than 10 cases in 2021 in Afghanistan and Pakistan. It's actually 2 cases. The wild polio virus 2 and 3 have been completely eradicated. India was declared polio-free in 2015, and the continent of Africa was declared polio-free in 2020. And Rotary has played a very important role in the global eradication of polio. So the story of Rotary and global polio eradication started with a grant, which was a health, hunger, and humanities grant that was started in rural Philippines in 1985. And after that, Rotary partnered with the World Health Organization in 1988 with the goal of global eradication of polio. And they became what's called a founding partner of the Global Polio Eradication Initiative, or GPEI. The contribution of Rotary members to the global polio eradication effort, more than $2.1 billion. Countless volunteer hours. Nearly 3 billion children across 122 nations have been immunized by Rotary in conjunction with GPEI. And efforts to combat disinformation, which is so important right now with the COVID crisis. And again, we've had with Rotary, with the support of local governments, we've also had national immunization days and sub-national immunization days. This is a picture of a national immunization day in India. And, so you would have hundreds of thousands of people who would be immunized on a national immunization day. Rotary also celebrates what's called the World Polio Day, and October 24th is World Polio Day, and here you're seeing a worker who is giving the vaccine, and this is in Africa. And this again is to keep the focus that we've still not finished the task. So what are the challenges? So there are areas of resurgence, there are challenges of war, there is ignorance in some parts of the world, and of course, the refugee crisis, malnutrition, the vaccine doesn't take that well in kids who are malnourished, and the political will. This is a picture from September 13th, 2021, and look at these kids, and it is from Kabul in Afghanistan. These kids are smiling, but they are really, really oblivious of their future, and we don't know if they are going to live in a world that is going to be polio-free or not. This is another picture that is from the GPEI, and this is a worker who is delivering the polio vaccine to a child and look at that backdrop of war. And right now, when we face the COVID-19 pandemic, we are kind of facing a war, and that is the war of, I wouldn't call it ignorance, but lack of trust in the vaccine. And so the Global Polio Eradication Initiative, these are the partners, these are public-private partnerships that have helped us overcome this disease pretty much throughout the nation, other than two pockets in Pakistan and Afghanistan. I have to say that the March of Dimes Foundation has played a very important role, and they were the ones who initially raised the funds to develop the vaccine. So what can Rotary do, and what can civic clubs do during the current pandemic, or the COVID-19 pandemic? Raising awareness for COVID vaccines and their safety in their communities, combating misinformation, supporting healthcare workers, educating the communities about vaccine hesitancy, and advocating for a fair and equitable vaccine distribution in vulnerable communities, and of course using the Rotary's polio infrastructure for COVID-19 vaccines in resource-limited countries. And this is Bill and Melinda Gates Foundation have been great supporters of the GPEI and the global polio eradication effort. And so this is Bill Gates, who's supported GPEI with more than $800 million, and his testament that we are pretty much near the end of the eradication of polio right now. This is a poster that is there from 1955. The girl's name is Mary Kolosky, and she was from Coyersville, Tennessee, and the young boy is 7 years old, and his name is Randy Kerr, and he was the first one who got the vaccine in the trial, the IPV trial that was held, and it's from 1955 to 2021, polio is pretty much on the verge of global eradication. And I think in the next 4 years or 5 years, we would be able to say that polio no longer exists on the face of the earth. Thank you very much.
Okay, Dr. Sachdeva, thank you very much. Appreciate that. There's Ms. Allison Adams. How are you?
Good, thanks. Thank you, Joel. I appreciate it. You and Dr. Sachdeva, thank you so much.
Say that again, I could barely hear you.
I said thank you very much for that presentation.
Okay,
Can
thank
you hear
you.
me now? Great, thank you.